Thanks, Delane. Good afternoon. Welcome to Nashville, and thank you for being here. I can promise you my talk won't be nearly as inspirational as my friend Penny. I was over there kind of getting a little teary-eyed. That's pretty impressive. So I heard my friend Marie did a sing-along. Is that right? And Penny gave a very inspirational and moving talk. Danielle and I decided you've had the good stuff, and so we'll just tell you a little bit about ourselves. So I actually know many of you in the room, I think, and when I was in the back, I heard that some of you know about my Gibson County roots and rural West Tennessee, and that's actually something that I'm proud to bring to this office. Is not only my rural Tennessee background, but my background in child abuse. And so I can actually talk about that a little bit today because you guys already know. So by way of introduction, I am a child abuse pediatrician. And I know most of you have already heard of what that is and know about that field. A lot of people, surprisingly, don't. They like, what are you talking about? There's a pediatrician that sees child abuse? Yeah. And I am still the medical director of the Madison County Child Advocacy Center, and Governor Lee has been very gracious to allow me to continue a very tiny clinical practice where I can still evaluate a few patients a week in that. So I'm thankful for that. Thank you. But, what else do I bring to this role as public health as a child abuse pediatrician? And I'm sure you know the adage, and you've heard it said, when all you've got's a hammer, everything looks like a nail. That's true, but doesn't everything go back to adverse childhood experiences? Don't the social ills that we have go back to that? And so I try to look at that objectively, and I'm like, do I think that because that's the field I work in, or is that actually true? And I heard actually one of our local CAC directors, I think he posted it on social media over the weekend, and he's talking about the actual number of ACEs that have to do with child abuse. Well, if you look at the list, that's a lot of them. And preventing child abuse is an incredibly difficult and overwhelming task. But it's one of those things, and child protection in general is so incredibly impactful. Look at the things that I deal with from a public health standpoint. We talk a lot about the big four. I know it's after lunch. Let's do a little audience participation. Okay, so the big four things that create early death and disease in Tennessee. Secret everywhere, not just Tennessee. So what are the big four? Shout it out. Obesity, but more so physical inactivity, excessive caloric intake, tobacco use, substance use, and misuse. This is a well-informed crowd. So if you look at things from a public health standpoint, particularly the Tennessee Department of Health, all of our efforts are focused on those big four. Again, physical inactivity, excessive caloric intake, tobacco use, and substance use and abuse. And so, if we could just solve for those, hey, we wouldn't have much of a problem, right? But if you look back at all of the ACEs, if you look back at opioid use disorder, you look back at, do you ever use food as medication? Yeah, we do that sometimes. And what do you do when you're feeling down or blue? It's a lot easier just to sit on the couch, right? You don't want to get up and move around. So many of the public health issues and the health issues in general that we deal with have to do with adverse childhood experiences. And so we were talking, I remember talking 10 or 15 years ago when I would do child abuse presentations about ACEs, and that was kind of before it was a thing, before it was a popular thing. But if you look at those and you look at the impact that you guys have in preventing or mitigating adverse childhood experiences, it's not just about what you're doing for the child and the family. It's about what you're actually doing for health in the long run. And I know that might seem like a stretch that you haven't made that link yet, but I encourage you to think about the public health impact of what you're doing every day. It's incredibly important. A statistic that I shared for the first time last Monday at something called TIP-QC, which is perinatal care, is something that I'm proud of. And if you haven't seen it yet, you need to, because it is a good example of how a multifaceted, or in our world, multidisciplinary approach to a particular problem can really have a good impact. So for the first time since we started measuring rates in 2013, 2018 was our first decrease in the rate of babies born with NAS. Yay! So the opioid problem is a major, again, multifaceted issue that requires all of us to deal with. But when children have a healthier start, they're going to be healthier for life. And I don't have to tell you guys that, children and the family as a unit is what we need to be working towards. From a public health standpoint, when parents are engaged or caregivers are engaged in their child, when they are more engaged in what they're eating and what they're buying and what they're watching and how much they're moving, those children turn into healthier adults. And you can really take it out from there. Healthier adults lower our health care cost, not only for those on governmental insurance, but also in our private insurances, in our employers. And when our employers have lower health care costs, guess where the extra money gets to go? In our pockets, right? So, hopefully. So, you really don't realize the impact on health, and particularly public health, that you're having by the work you're doing every day. I appreciate what you do. Please know that I recognize how incredibly difficult what you do every day is. And if nobody has stood up here and told you yet, please take care of yourselves. You are the ones who are helping the kids and helping the health of Tennessee. And so please take care of yourself first so you can take care of them even better. Thank you for the work you do, and thank you so much for all of the kind and encouraging words I've heard from so many of you. And if there's ever anything that I can do to help you, please let me know. I'm always asked, what are your priorities, or what are going to be your goals for this role? And the easy answer is I don't really have time to think about that until the legislative session is over, because that keeps us pretty busy for the next few months. But in all seriousness, we will be entering in a phase of strategic planning when the session's done, and I think you'll see a lot of focus on children and youth, maybe because that's the hammer that I've got. And so I appreciate you. I appreciate your commitment to Tennessee. Keep up the good work. Thank you.